Hi everyone, I'm Dr. Alexandre Sato, urologist here in São Paulo, Brazil. And today's video, we are going to discuss a little bit about renal colic. We know that kidney stone is a really prevalent disease in the world. About 50% of the population will be affected with kidney stone throughout their lives. And roughly about 30% of this population will be surgically treated because of an episode of kidney stone. Renal colic is that lower pain with high intensity. Uh, Suddenly, onset, it can be associated with nausea, vomiting, and can be associated too with urinary tract infection, and has a fever associated with the lower back pain. The diagnosis of the renal colic, the ureter stone that cause the renal colic, it can be done by ultrasound or CT scan of the abdomen. After we diagnose the ureter stone, we have to discuss the patient what methods of treatment we have to offer to this patient. And to ureter stone, we have just two methods. We can offer medical expulsive therapy, or we can offer surgical treatment to this patient. Medical expulsive therapy is a method where we can offer to this patient an alpha blocker that can relax the muscle of the ureter and facilitates the elimination of the stone. Mainly, the duration of this therapy and can be done to 4 to 6 weeks. And after this time, we have to do another scan to this patient to see if they passed the stone or not. And after this time, if the stone is still there, we have to discuss the patient surgical treatment because of the risk that his patients have to have an infection or altered renal function. The surgical treatments that we discuss with this patient is ureteroscopy, where we put the scope to the ureter, we fragment the stone with the laser and extract the fragments. After the treatment, we just put a double J stent that we leave there for 5 to 7 days, and we just take it out at the office after this period of time. Mainly, this double J stent we just leave there because to facilitate the elimination of clots to the patient who doesn't have renal colic after the treatment because of the edema of the wall of the ureter. We have some situations where you have an infection or a solitary kidney that we cannot offer medical expulsive therapy for this patient, and we have to offer surgical treatment for this patient. When you have an infection associated with the ureter stone, we just put a stent, just give antibiotics to this patient, and we wait to treat the infection. So after a period of time, we just put a scope again and treat the ureter stone. So if you have any question or doubt, just comment just above here. If you like it, just share with everyone as possible. See you soon.